Dr. Lund, I wanted to talk to you today a little bit about what a lot of times called the mini lift. A lot of doctors come up with new things, next day lift, lifestyle lift. I think you even have your favorite phrase for this procedure. What do you call it, and exactly what happened to this procedure?
Well, you kind of have to look at the history of where this all starts. As people's lives have become busier, patients didn't have the time, or do not have the time to take off the amount of recovery that's necessary for a standard facelift. So they were looking for quicker recovery techniques. And so plastic surgeons, of course, started looking to see how can we push the envelope of a shorter scar, shorter incision facelift to give as much result as we can get. And that's where all these came from. There's a lot of marketing hype behind it, as you can tell by the names. And much of it is completely unrealistic. There's certain companies out there that will go unnamed that are involved in a lot of litigation because they make promises that just simply cannot be honored. The technique that I like to use it's called a max lift, M-A-C-S lift. I didn't name it. It was named by Dr. Patrick Ternard, who is a Belgian doctor. He has published. It has been this technique is now well adapted in the world of plastic surgery, and it uses a shorter incision. It uses a technique that incorporates getting a fair amount of grasp of the deep tissue, so it's a long-lasting procedure, and it's a fairly quick recovery procedure. Be that said, no, it's not a next day procedure. It does require some recovery time.
And what exactly do you do with a max lift?
The principle behind a max lift is you're going to have an incision that starts inside the hairline, up here in this area, comes down, and depending upon if you're male or female, behind this little bump in your ear, and then will come around and stops literally about there in the back of the ear. And what you're going to do is that gives you a great amount of exposure, so you can get underneath and see the areas that have shifted and moved, which is the problem with a lot of short scar facelift procedures that others do, is that they have the incision, but because they don't get the exposure, they're relying on small sutures placed in very little areas like this to fix something that's all the way over here. Well, that's not going to work long term. The max lift allows you the exposure. And then what you're going to do is you're using a series of sutures and tissue movements that are going to lift this angle of the jaw up here, going to bring this back in here, and lift this fat pad back in here. And that's the whole movement. It really dramatically reshapes the face. I've had patients look at me afterwards and say, my face used to be a heart-shaped face or oval-shaped face, and then it went round or square, and it's back to being a heart-shaped face or being an oval-shaped face. And that to them is more important than even removing wrinkles.
So what areas does it correct exactly?
The max lift will correct the jawline. It gives a tremendous improvement to the jawline. It will correct the neck area here. Now, you may have to, in patients who have more sagging in the neck, we may have to make an incision here also to correct some of the neck muscles, or we may have to do a little liposuction there. But in many patients, I don't have to do anything. It's going to correct this hanging area right here in the face called your nasolabial area. It's going to bring that backwards and up. It's going to bring the corner of your mouth somewhat up. And then for patients who've had this migration of this fat pad here, this direction, and deflation, it's going to bring that back and recenter back up onto the cheek, which in a youthful face, this area is very full. And so the MAC corrects that quite nicely.
So who exactly is a candidate then for this procedure?
A good candidate for a max lift is a patient who is not aged beyond a certain point. And what I mean by that is if you come in and you've gotten to the point that your skin is just hanging like a Shar-Pei, or if your skin has had tremendous amount of sun damage, that you've got all these deep lines in that, no short scar technique is going to work in those patients because there's too much damage done. And so the MAC lift works very well for patients who have the usual signs of aging, starting anywhere, unfortunately for some patients as early as in their 30s, not common, but can. More commonly in patients in their 40s and 50s, even into their 60s, who have the early changes of facial aging yet do not have gone beyond that extent to the point that they need to have a full facelift procedure.
So is someone better off to wait to their 60s to have the procedure, or if they just maybe have a little bit hanging and they're in their late 40s? When's better and why?
The answer really is the earlier you approach the problem, the better your result you get, and the longer term the result you'll get. Now, it doesn't really make any difference what point in your life you do some type of facial rejuvenation. You're going to have some improvement. And thanks to the identical twin studies, we know that, let's say you have two identical twins and one gets a facial rejuvenation procedure like a MAC procedure, that person will move down the aging curve like this. You're not going to go back to looking like you're 20, but you're going to look very youthful for the age you are. This one stays here. If you look 10 years later, they look like that now. What happens is you're still going to age. You're still changing as your body goes. Facelifts don't stop aging, but you're going to look younger even at that 10 years later or whatever than your identical twin would. So for patients who are concerned about an aging facial change, that's probably the time to start addressing it. You may not even need a full facelift or a max lift or anything at that point. You may need something just as simple as a filler, but if you're starting to be concerned about it, it's better to approach it earlier than later, because if the problem gets going along too far, then it becomes a much bigger challenge to fix.
So how many years younger will I look after this procedure?
I don't know how many years younger they'll look. I don't think it's really easy to judge that. I tell patients we want you to look youthful for the age you are. I think it's unrealistic to be 60 and hoping a facelift procedure is going to turn you into 40 years of age or something. It just isn't going to happen.
So what do people usually say to someone that's had the procedure? Is it they can tell right away they've had something done, or is it a subtle change? What's the feedback you're getting?
That's a great question, and the answer is depends upon what time of the recovery they're in. Mm-hmm. Yeah, if you go out the week after you've had any facial procedure, odds are somebody's going to know you did something. But if, let's say, the patient has healed up in that, most patients are going to be able to go out and literally people will say things like, you look like you've lost weight, you're exercising, you must be dieting, new hairstyle, something. First of all, because most people don't think facelift is the first thing that's on their mind that they did something. They usually comment about the patient's appearance, how different and how just energetic they look and youthful they look. That's what most patients will see when they go here in comments. Very rarely does anybody hear, oh, you look like you've had a facelift done. Now that, of course, is if you have to recover.
So is it common to have this procedure, let's say if you do it in early 40s, early 50s, to have it again?
I don't know the answer in the max lift since it hasn't been around long enough for me to have patients now who are more than 10 years out. The max lift has been around for about 10 years, being modified and really tinkered with until its current inception. But if you think about it logically, we're all dynamic structures. We're all going to continue to age, no matter what we do surgically, etc. And if we continue to age, you would think that at some point in the future you may have to go back in and retighten something, or maybe add something. Because one of the things we've learned about aging is it's not just sinking and sagging in movement. Now we've learned sometimes you have to add back something in areas. Some tissues deflate as we age, and in the face. And if we need to do that, sometimes we have to add something back at a later stage. So I think anybody undergoes a facial rejuvenation procedure and expects to maintain as youthful a look as possible should anticipate at some point in the future they may have to be doing something else.
Well, let's talk a little bit about the procedure. You said the recovery is a lot faster than what a facelift is. How is the procedure different?
The difference is in a standard facelift procedure, the incision goes around, comes back up over to here, and goes back into the hairline, back into here. That's a standard classic facelift procedure. The incision here also tends to go up more in higher and in the back, further back in the hairline. For those patients, because you're now involving the back of the neck area, behind the ear, this area, there's a lot more swelling, there's a lot more recovery time built into that. When you use a smaller and shorter incision, and also you're not doing as much of the manipulating of the deep tissues through the different techniques where you have moving of some of the deep tissues directly, or using sutures or other tissues to move, that slows down healing also. So that's the shorter the incision, the quicker recovery. That's the principle behind all these shorter scar incisions.
So let's talk about the recovery. Is it outpatient?
For most patients, the short scar procedures, which the Max is one of them, are outpatient procedures. They can be either done in the office sometimes, even using a combination of oral sedation, some medications taken by mouth that help you feel more comfortable and relaxed, and using then also local anesthesia. Or you can have patients being done under different degrees of sedation or under general anesthesia, let's say in a surgical center or the hospital, and able to go home later that day.
Great. So what should they expect after surgery once they get home?
Well, the most important things are the patient should keep their head up and elevated, because swelling really is gravity dependent. And if you hang your head down, it doesn't take a lot of time, but that just an additional gravitational influence will cause swelling to occur. We do usually have the patients in some light dressing that we ask the patients to stay in for a period of time. And we also ask the patients to put some ice in certain areas on the face. And those things are going to be pretty much going on for the first few days after they get home. Again, you notice I didn't say the next day or whatever. They're going to go and need these to follow these guidelines for a few days in order to get the improvement as quick as possible. Usually most patients at about 5 to 7 days can start going out, particularly if they're women and they can apply makeup, they can go out and start going to the store if they need to, or driving here or there. But they're not going to be able to walk into a room of their close friends and no one have a clue that anything occurred, no matter which technique is being done. Usually it's going to take a number of weeks before the patient can really do something like that.
So we talked a little bit about what other people say after someone has had the procedures, performed. But I've seen your before and after photos where some, it looks like mother-daughter. What do patients tell you after surgery? I guess it sounds like it's worth it.
Yeah, most of the time, I usually talk to my patients the evening of the same day I do the surgery, and sometimes they verbalize like, well, what's it all going to look like? Because of course, when you're all wrapped up, everything looks rather interesting for the first few days. But it's amazing how many patients at 2-3 weeks out look at you and go like, wow, I just didn't know I could have done this. And then we talk about what we need to do to maintain it, and I'm not just talking from a facelift type of procedure. There's so many things. Then we start talking about, well, let's work on the skin now. Let's make it as youthful as possible. And there's things, but most patients are just thrilled.